What's up, guys? My name is Mark Bartriff, and today I'm going to be talking to you about coronary artery disease, also known as CAD. And it's kind of a broad term, and it includes chronic stable angina, which is just pretty much chest pain. There's two types of angina, which I will talk about later on, but it also includes acute coronary syndromes, which I will also talk about. So, coronary artery disease. To the left, you will see a normal artery. That is a great looking artery, if I do say myself. And that will, provide blood and oxygen and nutrients and all the good stuff the body needs through that artery. But the one on the right is what we are here to talk about, and the major problem. And as you can see, the yellow stuff in there is called plaque, and that is, that's building up in those arteries, and that's not good. It's going to lead to a serious problems. While I explain. This next diagram is just, again explaining to you how this plaque is building up. And what plaque is, it's just pretty much cholesterol deposits which accumulates, in your arteries. And this process is called atherosclerosis. And when this plaque builds up, it causes angina, like I was talking to you before. And the condition causes chest pain, angina, and discomfort because the heart muscles are not getting the blood they need. And so, before myocardial infarction, patients are gonna, be like, "Oh, ow, my chest is hurting." Well, ding, ding, ding. That's your body saying, "Hey, man, I'm not getting all this oxygen and blood and nutrients I need to keep on pumping." And so, that's a major sign before a myocardial infarction. And you might be thinking, well, how do I know? Or like, when am I going to develop coronary artery disease? Well, let me tell you, this might be a little scary at first, but it's happening right now. Your arteries are day by day, month by month, are becoming less and less elastic, and you need that elasticity for your arteries, so it's easier for them to pump that blood to all your your vital organs, and to get all that blood and oxygen and nutrients to everywhere. And as you age, that elasticity is decreasing, and uh, causing stenosis into the arteries. And that that's what you really can't change, because as you get older, you can't you can't change the way we age. But one thing that you can change is your diet, and your diet really does affect if you're going to get CAD or not. For example, if you eat a lot of fatty foods and not so healthy, you eat McDonald's every day, a plaque and cholesterol deposits are gonna collect in those arteries, and you're gonna be at increased chance of getting CAD. And what you need to do is eat foods that are healthy, and stay away from those nasty McDonald's, Wendy's. Sometimes Wendy's have some good food, but you know what I mean. You need to stay away from those food that are so high in fats and cholesterols, because that's gonna increase your chance of getting this disease.
Now, a home video of CAD.
What's up, guys? My name is Mark Bartriff, and I'm here to talk to you about the pathophysiology of coronary artery disease, other known as CAD. And we're all in college, so we all know what this is. Yes, it's a wall bong. Actually, two bongs that come out from this funnel. And it's a hit in the college life. So I was like, wow, why don't I just use that example for coronary artery disease? So for this right here, this is a nice healthy artery. All the blood's flowing, everything's going, oxygen's getting to the cells, and all the good stuff. But as I will show you here, and then here really soon, that when someone has coronary artery disease, plaque builds up in the arteries, narrowing the artery, called other known as stenosis, and it's harder for the blood to get to the cells, and leading to ischemia and other problems that can relate to ischemia and stenosis in the artery would be, myocardial infarction and a bunch of stuff. But we'll talk about that later. Here is the example of what I'm going to show. So right here, this is the artery that's healthy, no stenosis in there, no plaque buildup, and I'm going to show you what it would look like, a demonstration of what it would look like, of a healthy artery. So as I told you before, this is a bong, and this is a healthy artery. The blood pumping and everything, and it's going to the body. Look how clean that flow is. It's perfect. But with CAD, coronary artery disease, there's a little blockage. You can't see it in the video, but I put a little blockage in here, and this is what it would look like with someone that had CAD. See, you can't see it in the video, but it's blocking it's blocking this right now, and so the blood is not getting to the cells as fast enough, and that can lead to see how slow it's going right now compared to how fast that is, and that just leads me to my point. If someone has that plaque buildup, and has the narrowing of the arteries, it's gonna affect your body as a whole.
Okay, so to wrap this up, I just wanted to emphasize the point that when I'm talking about coronary artery disease, I didn't want you guys to get confused about, it's affecting all arteries, which, in return it can, but I am talking about the coronary artery itself. And the coronary artery is, as you can see, it's right there located on the heart, and it's in charge of giving that oxygen rich blood to your heart. And so if you have CAD, the blood is not getting to the heart, and it's going to cause problems, angina, myocardial infarction, all the problems that I talked about, because of the blockage and the narrowing of the coronary artery. What I did want to emphasize on as well is the most common result of CAD is the atherosclerosis that I talked about. The plaque buildup, cholesterol deposit that's in your coronary artery, builds up and, causing CAD. And the cause of CAD is, like I was telling you before, is a myocardial infarction. And, one of the most common symptoms of that is chest pain. And that's because of the deprivation of oxygen. Your heart's not getting as much oxygen. And so, your chest pain is like, dude, this is hurting, man. And, you need to see some of that when you have angina. Another symptom is dyspnea. I sometimes have trouble saying that word, but that's difficulty breathing, and that's the second most common symptom of an MI. It's because there's increased metabolic needs during an MI. But what I wanted to talk about as well is that your increased chance of getting CAD if you're cigarette smoking, if you have hypertension, if you have diabetes, and it's also hereditary. It's genetics is involved as well. Also, you want to make sure that you keep your HDL lipid proteins up
And your LDL lipid proteins down. So HDL up, LDL down. And that's all I got for you guys today. And thank you for watching the video. And I hope you guys learned a lot about coronary artery disease and the pathophysiology of it.